Imagine that up to 1 in 3 women undergoing gynecological evaluation may have adenomyosis, a chronic uterine disease causing severe pelvic pain, heavy menstrual bleeding, and infertility. Despite its prevalence, current treatments only manage symptoms and do not stop disease progression. Hi, my name is Tina Chin, and my project investigates whether Galectin-3 or Gal3 drives inflammation and fibrosis underlying adenomyosis, and whether targeting it could offer a new non-hormonal therapy. Adenomyosis primarily affects women of reproductive age and significantly impacts quality of life. This is driven by excessive extracellular matrix deposition, which thickens and stiffens the uterus, disrupting contractions and causing severe pain and abnormal bleeding. Current treatments including hormonal therapies or surgery. While these may relieve symptoms, they do not target fibrosis, can have significant side effects, and are not ideal for women who want to preserve fertility. This highlights the need to identify an upstream regulator linking inflammation, fibrosis, and abnormal contractility. Gal3 connects inflammation and fibrosis in other organs like the liver and lungs, but its role in adenomyosis hasn't been studied. So I hypothesize that Gal3 is a central regulator of disease progression and that its inhibition could reverse disease-related changes. I first analyzed publicly available transcriptomic datasets and found that ALGALS3, the gene encoding Gal3, is significantly upregulated in adenomyosis, especially in uterine smooth muscle tissue. Genes correlated with ALGALS3 were enriched in inflammatory and fibrotic pathways, suggesting Gal3 actively drives disease. To test this, I developed 2 in vitro models, an inflammatory model using IL-1 beta stimulated endometrial stromal cells and a fibrotic model using estradiol and TGF-beta treated uterine smooth muscle cells. In the fibrotic model, stimulation increased Gal3 expression and activated SMAD2 and 3 in signaling, which I measured using Western blot and flow cytometry. Proliferation and extracellular matrix remodeling were assessed by qPCR for Ki67 and FN1, along with alpha SMA immunofluorescence staining. Applying a Gal3 inhibitor reduced SMAD2 and 3 activation from 78% to 14%, decreased Ki67 at FN1 expression, and reduced smooth muscle activation. Functionally, collagen gel contraction assays show that fibrotic stimulated cells were hypercontractile, especially with oxytocin, but Gal3 inhibition restored normal contractility. In the inflammatory model, IL-1 beta increased PGE2 secretion, measured by ELISA, while Gal3 inhibition significantly reduced it, demonstrating that Gal3 also regulates inflammatory signaling. Taken together, this study showed that Gal3 drives inflammation, fibrosis, and abnormal contractility in adenomyosis, and that inhibition can restore normal uterine function. Targeting Gal3 represents a potential non-hormonal fertility-preserving therapy. Rather than just relieving symptoms, it addresses the root causes of disease, helping patients regain control over reproductive health, quality of life, and well-being. Moving forward, I will validate Gal3 inhibition in physiologically relevant systems, including multicellular co-culture and in vivo models, to explore cell-cell interactions and confirm its ability to reduce extracellular matrix remodeling and sustain inflammation. Thank you.